My son was about a year and a half old. He woke up probably like 2 a.m. and started screaming with a lot of pain. Now, I couldn't see anything physically wrong with him.
A very good afternoon to everyone. It's so good to be here, and congratulations to PSHAN on the annual conference. Before we begin, I would like you to picture this. So you are walking on the road, and then you have a gripping, crushing chest pain. It's pain that you've never felt before, and you are sweating bullets. You are completely terrified as to what this pain might be. And you begin to have an impending sense of doom, and your life begins to flash before your eyes. But here's what the catch is. You are in Agege, and you are not sure of what to do. You hit the ground, and every labored breath that you take, you are sure that it is going to be your last. And the last thing you remember is them shoving you into a korokwe. And the next time you open your eyes, you see God telling you, welcome home. This is the story of a lot of Nigerians. But here with me is someone that is changing that narrative. Do you realize that it is possible that that person, not me, could have gotten help in 10 minutes, and that myocardial infarction, which I think is what that person was having, might not have killed that person? And so Emergency Response Africa is trying to make sure that every Nigerian, all over Nigeria, and possibly even Africa, gets emergency response in 10 minutes. I am here with none other than Folake Owodunni. She is the co-founder and CEO of Emergency Response Africa, a healthcare technology company building the infrastructure for fast, reliable emergency medical care across Africa, beginning in Nigeria. ERA, Emergency Response Africa, has managed over 8,000 medical emergencies, reduced response times by up to 80%, and built government partnerships with Edo, Ogun, and Rivers States. She's a recipient of the Aurora Tech Award and the Google Black Founders Fund, among other recognitions. Please kindly make very welcome Folake Owodunni.
Thank you.
Thank you very much, Folake, for joining this podcast, my very first episode.
I know, same here. Thank you for having me.
Brilliant. So, there's a backstory to why you started Emergency Response Africa, and it has something to do with something that is very personal to you. In Canada, I gathered that your son had an emergency that was responded to in 10 minutes. Tell us what that story was and how it became Emergency Response Africa.
Yeah, thank you so much. It's really a pleasure to be here. Congrats to PSHAN and to just everyone here. So the story goes first-time parent. And I mean, based on what you do, you know how first-time parents are. We care so much. We're so concerned. We're watching every breath. But my son was about a year and a half old. He woke up probably like 2 a.m. and started screaming with a lot of pain. Now, I couldn't see anything physically wrong with him. So after plenty of frantic checking, calling my husband who was away, I decided to call 911. And, you know, the thing about us as Nigerians, 911 is what we see in the movies. It's not necessarily a part of our lives, our reality. And so even the act of calling 911 was quite nerve-wracking for me. But everything that happened from that phone call all the way through to the end really made it clear that, okay, we're missing out in Nigeria. So what happened? First of all, the medical dispatcher on the line was very clear, very comforting, but also very professional, said what we were going to get in terms of a response. And within a few minutes, the paramedics came, they had their stretcher, they had all their equipment, and they started checking him out. Now, I think what really stood out to me was at the end, they said, okay, we've given him this medicine, you know, he seems to be fine. You actually don't need to get into the ambulance with us. If you go, you're just going to wait in the ED. Instead, you know, in the morning, see your family doctor, all of that. And that was the end. And I remember thinking about where my husband and I used to live in Nigeria. in Lagos, actually, down Lekki Ekpe Expressway. And just the concern around first, if the same situation had happened, I don't even know who I would call. But let's say I decide to get in my car because that's kind of the most likely thing. I'll have to go and knock on my neighbor's door so that they can move their car so that we too we can reverse out and then we can start going to the hospital. But then the concern of when I get to the hospital, what is going to happen there? Are they going to be prepared? Are they going to have what he needs? Or are they going to say, sorry, go to so and so, go somewhere else for help? And that really was the spark for us. I have a public health background, so I've always been interested in healthcare access, but that led on a journey of research and really starting to understand that as Nigerians, we don't really have, or we haven't really had a history of where to go when faced with an emergency, and we've always had to solve it our own way. So that's the journey, and that's really what led to what we're doing today.
I find it very interesting. So, like, where were you living? Face me, I face you, having to call your neighbor together. Me, I just drive out of my house. But that's the reality of living in
Yes.
Nigeria. That, as a matter of fact, I've seen sometimes where people have actually even had to call their neighbors to transport them to the hospital
Yep.
simply because they just didn't have any transport
And chances are
access.
I would not have been able to drive in the state I was in. So
I've seen a premature baby being transported in a taxi, and the taxi overturned with the premature baby in it. Fortunately, these babies, angels are watching them because the baby actually survived. So I totally get where you're coming from. But here's what I think I'd like you to tell us. Nigeria is a very unique ecosystem in any regard in which you view it. And so tell us what building emergency response Nigeria in Nigeria has taught you that no business school, no global program has taught you.
I mean, that's an interesting question. I would say, and probably anyone who's an entrepreneur. I mean, there are a lot of leaders here in this room. They can say this: the amount of resilience and persistence that you have to have. This year, Emergency Response Africa turned 5 years, and I'll be honest, where I thought we would be after 5 years and where we are, I mean, they really don't compare. But I think for me, what keeps me going and what I really didn't learn I have two master's degrees, one in business, one in public health, and I didn't learn this in any of them. The amount of resilience that you need to keep going. And I think for me, what keeps me going is that sense of, yes, we may have tried, we've done some things, but the problem still persists. The scenario you gave at the beginning, if it happens today, God forbid it won't happen in this room, but let's say it does. How many of us actually know what action to take? How many of us can reliably expect a response? And the answer is still not many. And so I think for us, that's really what keeps us going.
I think that's brilliant. A round of applause, please, for that response. I think you really have crystallized, the idea of the challenges that exist. And I was before we came up, we're talking about how sometimes, even when you do need to try to get somewhere, a place that is 10 minutes apart without traffic can be an hour apart with traffic, or 1.5 hours with traffic. God forbid the trailer should fall on the road. And I was asking if you have a helicopter in your repertoire, and you said not yet. So
Not
we're
today.
actually, yes. So there are lots of investors here in the room. So hopefully they should chip in. So now, when it comes to running Emergency Response Africa, I realized that there are many moving parts. There's people, there's logistics, there's the whole gamut of resources that you have to coordinate to make sure that it runs like a well-oiled machine. Now, which of these is the hardest for you to keep working consistently?
Yeah, so I mean, I could answer that question multiple ways, but maybe in keeping with the theme of the event and, the conversation around financing that happened on the previous panel, if you think about what an emergency is and what it means for an individual, it means that multiple things have to happen at the same time for that person's life to be saved. Again, let's use the example that you started with, right? You're walking in Agege, you have an MI, and you sleep and you wake up, hopefully not in heaven or hell. And in that situation, if it so happens that a person can pick up the phone and call even an emergency response Africa. Now, this is a person that we don't have any previous relationship. They don't have a subscription. They're not calling from one of our insurance partners or our corporate partners. This is just a Nigerian, out of the blue. Typically, when you think about healthcare, somebody has to pay for care, right? So then you're faced with a situation where somebody is dying. Are you really going to send them a bank account to make a transfer while they're having, a cardiac arrest? It doesn't make sense. But that is unfortunately the reality of a lot of what we do see. And where there are government services, case in point like Lagos, I will say Lagos State tries, right? Yes. So where there are government services, you can refer such cases there. But the reality is they don't have the capacity to meet the needs of the 20-something million people in Lagos. And so to your question, who pays for emergency care? Mrs. Falala, you talked about the role of insurance, and it's true. It's so critical, so huge. But we're not there yet, right? Where that is reaching everybody. At Emergency Response Africa, we actually had to start a fund called the E-Fund, the Equity Fund for Emergencies. Why? Because we realized that, again, I can't send you account details, but how do I cover my costs? So now we're having diaspora contribute to that fund, and that allows us to attend to those kinds of cases, and the process can continue. So there are other things I can talk about. How do you ensure that an ambulance is truly in a ready state when it says, we are ready? Ready is not, there's fuel in the vehicle, although that's one of the things. Ready is also, is there oxygen? Are the consumables there? Is there a medic actually available and ready to attend to the patient? Those are some of the things that we really have to try to struggle to navigate. But, slowly we're getting there.
As you're halfway there already, actually. You're clearly talking from all the experiences, that you've experienced, shege and no shege. But the truth of the matter is that, you touched on something that was very important, and which is, of course, funding. And that brings me to the question of the fact that you've collaborated with state governments, so there's Ogun, there's Edo, and there's Rivers. And so when you think about public-private partnerships, particularly for emergency response services, how should the ideal public-private partnership, what should it look like here in Nigeria?
So I can tell you some things that have happened that aren't great, and some things that have worked really well. So we've had the privilege, you've mentioned the states already. And one thing I can say for sure is that the success of any public-private partnership really, really, really depends on who is leading the charge on the public side, right? Because it's a matter of commitment, and not just commitment in terms of, yes, we'll do it, or a willingness to sign an agreement. It means that whatever resources each party has committed to bringing actually needs to happen. And then what happens beyond, the pilot period? There was conversation around pilots, and maybe you'll still talk about this. But a lot of times for a private organization getting into a public-private partnership, there's a lot of risk on both sides. So how do we start small? We come up with a pilot. And that's what we've done across multiple of these. And on the one hand, and I'll use Ogun State as a good example of a pilot that went really well, we actually partnered with Ogun State to help them set up a rural maternal emergency transport program. So that is literally saying, in the more rural areas, between government and private sector, you are not going to see ambulances. But how do those people still get to care, especially pregnant women, when they're faced with an obstetric emergency or a labor complication? How do they get to care? And so the approach was to train community first responders and use available vehicles and create a system that strengthens referrals. We did a pilot, and that worked so well in terms of increasing utilization of the the private healthcare facilities, increasing access in emergencies for the women, that the state went on to actually take that and scale it to more local governments, and they've sustained it. And I think that's a really good example of, if you start something as an innovator, what you can do is catalyze. But we are not going to be able to be responsible for continually providing the services to the community. That is a job that government does. And so what's been really valuable it has been having the privilege of working with leadership that really wants to see that happen. It's not been perfect, don't get me wrong.
Yes.
But just the fact that the commitment is there and the willingness to see results and scale on the basis of those results, I mean, that for me is an example of what a good public-private partnership should look like.
So I think that's brilliant because I think you're talking in terms of think globally but act locally, and actually think of resources and what's available in the locality to make sure that whatever great technology is available in the wildly urban centers, you can adapt it in some way to make sure that the people in the local governments and in the more rural areas have some semblance of easy access or easier access to emergency services by training people that they trust, that they know, and that of course has to be driven by the governments in that partnership. So brilliant. So really well done. Now let's talk about the challenge of adoption. The theme for this conference is actually healthcare innovation, digital innovation, and how Nigerians can adopt it. I run a very small tech startup, Agnosis Care on Demand, where we just provide, small services to mothers to just help you to answer the simple healthcare related questions. Why I'm not lactating well, my baby seems to be spitting up every breast, his breast milk all the time. And then we said, okay, you know what? We'd like to have AI answer your questions. And they ran for the hills. They fled because they're like, oh, you know what? This is not going to happen. So we had to scrap that idea. But for you, tell me about what the challenges or what challenges. Now, the question actually says that you have gone from pilot to scale. And I'm assuming that that is accurate. So tell me how, in terms of adoption, you have gone from the pilot phase and now you are at scale.
I'll probably end up answering a slightly different question. Just bear with me. Adoption is a huge challenge, I think broadly, but especially in healthcare. I don't think we're any exception to that. And I would say like what we've learned is that especially when you are doing something that people have not had reason to trust for decades, you're not going to see adoption automatically. Right? It's as much as you're investing in the infrastructure, you're investing in the technology, you also need to invest in the community engagement. You need to invest in the education.
Yes.
And so we have had to spend almost as much resources building the platform and bringing people onto the platform as actually helping them understand what does it mean to recognize an emergency. Because you gave the example of the person walking in Agege having the MI. The people that are going around doing their business, what do they know? They may or may not recognize that something is wrong until the person is on the ground, literally. And even then, and I think most of us know this, even then, that's when somebody will bring out phone and start recording. Another person will say, bring water, pour water, pour water. You might even hear bring kerosene. I don't know what they want to do with the kerosene. So there's a lot to do in terms of the education. And I think oftentimes that's the part that not only do we miss, we forget that that is the part that is not always commercially, I don't want to say commercially sound, but it's hard to use core commercial capital for some of those types of tasks.
Yes.
But you cannot be successful, both impact-wise and commercially, if you don't invest in that. And so I think that's why, when we talk about, how do you fund healthcare? It always has to be a blend. There's a big role for commercial capital, but there's also a big role for capital that is really about how do I take people from a certain mindset to a different mindset.
Thank you very much. And I think that's really key. Because again, as you said, education tends not to yield immediate returns. And so that can be challenging to pitch to investors to say that you need behavior change, for things to actually move forward. Now, investors talk about returns. Policymakers talk about frameworks. At the end of it all, what does the Nigerian actually need from digital health? And are we building close enough to that?
I don't even know how to answer that question. I think everybody wants a different thing, right? Is what you're saying. Oftentimes, and I think you said it while we were talking, a lot of times what we miss is the patient point of view, the customer perspective, the user perspective. At the end of the day, what do people want? They want to get care when they need it, how they need it, and at a cost they can afford. That isn't going to put them into generational poverty. And I think, from that mindset, for us, the way that we've always thought about it is our responsibility is to be as creative as possible with finding ways to do that. So I gave the example of the e-fund that we set up. It's not because we want one more thing to do. It's not because, we think, oh, there are too many people who can't pay. It's simply because we've seen that there's a need. And what we are doing now to make money does not cover a subset of people that really need the service. As a social enterprise, we're committed to the impact. So how do we balance those two things? You mentioned, investors wanting returns. I think for us, what we've learned over time is to be intentional about who we're speaking to and who we're taking funding from, and make sure that they also understand that what they're investing in has these two sides to it. So like I mentioned, yes, I can pursue today an oil and gas contract and make a lot of money as an emergency services company. And we do. But at the same time, that does not solve the problem of the pregnant mother in the village somewhere. So how do I then have a model that addresses that? And I think that dichotomy is what's really difficult in healthcare in Nigeria. It feels like you have to choose one or the other. And I believe that, yes, you can't do everything at once, but at some point we should be able to truly solve problems for those that need it.
Okay, do you think that the reluctance, maybe not say reluctance, but the challenge with getting funders and capital into the healthcare space in Nigeria is as a result of the fact that healthcare is perceived as being unprofitable, more social, a bit more charitable, and kind of like actually also reflects, in things like budgetary allocations, right? So do you think that people just think that the healthcare sector is unprofitable and that's why you don't get patients? I learned about patients funds today. When I had patients funds, I thought it was like patients in which ward? In which ward? Is it ward A2? But actually, patient funds and, actual, venture capitalist money. How do we get that funds or those funds, getting them to see that healthcare is not as unprofitable as you imagine that it is?
I mean, an investor wants to put in money and get that money out. It really is as simple as that. While ideally, yes, there's impact along the way. I don't remember who said it on the panel that there are no true impact investors. That's something I've actually heard quite a bit from people that are impact investors. And so I think, when we're realistic about the fact that investors want to put money in and have a sense that that money is going to come out at some point, then it allows it to be easier to judge it for what it is. Again, from our perspective, we've realized that an investor that's going to put money in and wants it back in 5 years is probably not a good fit for us. Not because we are not a smart team, not because we are not, we don't have a fantastic technology solution, but because we recognize that this is a market that has lacked trust for so long. So half the work, especially in this first fight, is just even trying to build the trust, is trying to educate, right? Again, those are things that may not necessarily generate the returns in 5 years. But an investor that says, what, I understand where you're going, I see the vision, and I'm willing to invest in that long-term vision, and says, hey, I'm willing to be patient for 10 years, 15 years. There are not many, but there are some. I think for us, it's been about how do we find and align with those, or how do we blend, right? So certain parts of the business are funded by a certain type of investor, while other parts are funded by another. Those are the things that we're learning on this journey.
You've clearly thought about this for a very long time, dreamt about it actually.
In many years.
So really well done. So just say something, just a few words to just let us close the podcast. What would you just like to say to whoever it is you'd like to say something to, whether it's investors, whether it's the general public or anyone?
I mean, maybe I'll say a word to PSHAN. Again, well done for pulling this conference together. I think PSHAN sits at a really important place in the ecosystem, bringing together really some of the largest organizations that have built amazing businesses. Let's channel that support into the innovator ecosystem in a way that makes sure that those of us that have been doing the work can see a pathway to not just growth in, one state or two states, but true scale. And those are things that really, again, don't come, automatically. It really does take partnerships and collaborations. And I think PSHAN is really in a great place to do that. So thank you.
Thank you so much. Absolutely brilliant, Folake. And this brings us to the end of the podcast episode.
Thank you, Dr. Renner.
Thank you very much,
Thank you,
Dr.
man.
Renner.